Hey guys, so I wanted to make a guide for you all as far as kind of talking about each rotation, what you can do to study, the best resources, things like that, kind of like what I did, just as a guide to help you out through this year, because third year is a little bit different than first or second as far as studying, and it's definitely different than dedicated, which you guys are just coming off. So for those of you who have already finished COMATs, and if you've gotten your score back, congratulations. If you have not taken yet, keep going. It's almost over, and third year gets better. So first of all, just talk about third year in general. Obviously, the obvious thing is you're going to be in the hospital, so you're going to be working, whatever hours it is, which is where studying becomes difficult. It's nice to go and learn in clinic and learn the clinical side, but you also still have didactics to do, which it can be tough to balance sometimes depending on what rotation you're on. Because just because you learn something in clinic doesn't necessarily mean it's going to be something that's important for your test, because there still is a little bit of a disconnect between book learning and clinic learning. A lot of preceptors are very good about, kind of questioning you on different topics and then saying, this is what we do in clinic, but for the test answer, this is the answer. That's really, really helpful to kind of be able to differentiate the two, because I know that for sure I've missed practice questions because I went with the clinic answer because of things that I had talked to them about, and that was not what, the technical book answer was. So the other hard thing is you're going to work, let's say on average 8 to 5 or whatever it is, and then you still have to come home and study. So it's difficult in that sense. You don't have to study near as much for COMATs and end of, rotation exams, but it's still frustrating to work 8 to 9 hours and then have to come home and do 2 to 3 hours of studying, kind of minimum. Um, there are a lot of rotations where you get time to study during the day. I know on my pediatrics rotation, I did most of all of my studying during the day except for practice questions. And that's just because that's how that clinic was. So it's going to be an adjustment, and it's definitely something every single rotation you're going to have to change it up. Some rotations require a lot more work, which I will get into each of them here, just based on my experience. And then we'll kind of talk about, what you can do. So really quick to get it out of the way, just for reference, my average COMAT was a 121 that put me about 98th percentile on average, and then STEP I just got back and ended up 263. So just a reference for what I did and then where I ended up. So take it or leave it. So we'll start with surgery. Surgery was by far the hardest COMAT I had. It was also my first COMAT. But the formula for each rotation for the most part is the same. UWorld is your number one resource. Hopefully the school gives you that again. They gave it to us for free for step 2. And it doesn't matter if you're taking STEP and COMLEX or just COMLEX. UWorld is by far the best resource for every single rotation. It's not even close. There's nothing out there that's completely comprehensive, because step 2 material, as you'll see, is really vast and vague. So not everybody, no one resource can cover it all. But UWorld does its best to do that. Most of the important stuff is there. With that, every rotation you're going to get assigned like online med-ed videos, some modules maybe on Blackboard, ComBank quizzes. My goal was to always get every bit of that done in the first week. Reason being is online med-ed is a very good resource for baseline information, like if you have no idea about a topic, but outside of that, it's lackluster. But it's a very good base for you to start off of. For the most part, I kind of just threw it on double speed, listened to them, and then knew that I was going to use UWorld as my main learning source. Then ComBank quizzes, same thing. Just for us, they were, as long as you hit a minimum score, you got the points for it. And then also, because I'm a flashcard person, I use the Zonky Step 2 deck. It's TZANKI. I think it's a Torquay Zonky mix. And I'll post that for you guys, my version of that, because I added a deck to it, because since we do a family med COMAT, there is no family med in UWorld, and Zonky is really based off of UWorld and some extra stuff there too. So that's what I used. I want to say the deck that I just offloaded was like 9,000 cards for the whole year, so it's really not that bad. It's the thing with the cards is that cards for step 2 take a long time because every single card is almost like a question stem, because what you'll notice moving to step 2 material is that for step 1 you could keyword the mess out of things, read about 3 words in a stem and know what the answer is. But for step 2 there's a lot of interpretation of where you at in the clinical process to know what to do next. So that's what makes step 2 a little more difficult, and the cards take a lot longer. Like if I have 300 cards to do in a day, I am dreading it, whereas for step 1 that was a little over an hour kind of thing, maybe. So that's that. So I did the Zonky deck for every single rotation. Same thing, just tried to get it done as quick as I could. Basically figured out however many cards there are and tried to finish that in 3 weeks. So that way I had a whole week of, I've seen everything that the deck wants me to know. And then I would, just continue my cards up through my COMAT. UWorld, I started from basically day 1. Use it really as a learning tool. It's going to crush you. I definitely was caught off guard. I left step 1 feeling like, hell yeah, I know this stuff. Like I killed it. And then I get to step 2 material and I'm getting my ass handed to me, because it's new. There's so much stuff you guys haven't learned yet, things you didn't know existed. So just keep that in mind, that like, yeah, your scores are gonna be not great, but use it as a learning tool. Continue to do the cards and everything from there. So the goal with UWorld for me on every rotation was to try to finish UWorld in 2 weeks, for whatever subject matter, and I only did it subject specific during each rotation. So if there were 400 surgery questions, I knew that was 10 blocks I had to do. So I, did it to make sure, like, okay, by the start of the 3rd week, I want, or, maybe, Tuesday, Wednesday of that week, I want to be done with UWorld. Some days you just can't get to a block of 40 after work, which was usually my goal, to do 1 block after work. But try to be done, a week and a half, 2 weeks before your actual COMAT. Reason being is that I highly recommend also buying the ComQuest COMAT question banks for each individual COMAT. So it's not that it's a great resource overall or that it's better than UWorld. The thing is that it was the most like the COMATs, being that like COMATs are not worded great. And I know if you guys have taken ComLex, you've seen kind of their testing style, and the COMATs realistically were like little short segments of ComLex. They're okay. So ComQuest was like that. So it was nice to have another few hundred questions to go through and, another data point. So basically I tried to be done with that by Tuesday or Wednesday before the COMAT. So basically try to do all of ComQuest in a week or so, which is more than reasonable. Like those questions don't take the same amount of brain power or time. So I've gone through those 2. Obviously you have the ComBank assignments, doing my flashcards as I can get to them, keeping up with them as best as I possibly can, because it's a really, really big deal, to see it as many times as possible. And then for the COMAT, you just go in on that Friday or whenever and just take it and you're done. They're 125 questions straight through. I want to say you have 2.5 hours or so. I don't really remember. It's been a couple months since I've taken one. But they're okay. They're not, if you survive ComLex, you'll survive your COMATs for the most part. Just don't go into them half-assed. Like go in and have studied hard. Give yourself the best chance you can, because there is a pretty good correlation with COMAT scores on average and then your actual exam day score. So let's see. That's really it for the resources. There is, for most rotations, a Emma Holiday PDF or videos. I don't remember exactly which ones she has them for, but they're on the internet floating around. You can find them. Pretty good high yield last minute review stuff. Some of it's outdated, so you just have to know your stuff before looking at it, or else you could be memorizing something wrong. Like the most common causes of some diseases like bugs and stuff may have changed at this point. But Yeah, so for surgery specifically, the only other resource I used was Pestana Surgical Review, and it's really just I used it as a question bank, very detailed, very specific, um, but it was good to have some more questions because I felt like UWorld was tough, but it wasn't that bad. ComQuest was pretty easy, and then Pestana was difficult. It goes after some details that aren't quite important, so just use your best judgment. Um, Surgery being my first COMAT was my worst one by far. Got a 106 on that one. So it was just a hard test. And I know a lot of other people who, very, very smart students. And that one, they're like, yeah, I don't know, struggled. So I kind of panicked right off the bat. But um, after that, I had pediatrics. So pediatrics, again, I used the Zonky deck. I used UWorld when I got home. And then ComQuest in the same exact way. Did the online med-ed as early as possible, kind of just get it out of the way, do your assignments and just get them done. Because I don't think that a massive amount of learning comes from them, but it's a really good introduction. So if you can just get through them, it can be helpful. Then for peds, so same thing, did the question banks. The 2 days before, I actually went and took the NBME shelf self-assessments and kind of used it to gauge. They weren't really accurate. They were all over the board. I want to say I was like 70-something percentile on the shelf practice exam and was like, well, here we go, going to bomb this one again. And ended up 99 percentile with a 123 on peds. So peds is not too bad. Lots of memorization and micro and farm, vaccination schedules, developmental milestones are things that if you just look at them enough, they just stick, guys. And that's where the flashcards really come in handy because they're very much geared to get you to memorize that stuff. And then try to keep up with the surgery cards if you can. If you can't, don't stress it too much. I tried as hard as I could to do it, but it just sometimes it's too much. If you can keep up with it, it will help when you go to actual step 2 prep. So that's it for my recommendation for peds. Invest in tissues because you're probably going to get sick. So after peds, I had 2 months of family medicine. So you have your family med rotation, but then you also have that primary care selective, which for us was not really a selective. We got assigned to family med. So it was nice because I had 2 months to prep for the family med COMAT. Now, so there's a lot of info, and this is one that a lot of people struggle with family med because it's a vast amount of information. So you're covering a lot of topics, your typical family med stuff, but for whatever reason on COMATs, they love to test you on OB material. So if you haven't had OB yet, you're going to need to do some OB review. And they also hit a lot on peds. So definitely, look over those 2 subjects too. Don't go into the COMAT, just looking at some family med stuff that you've looked at. Probably the biggest thing in family med is diabetes management, hypertensive management, and then the USPSTF guidelines for screening. When do you screen someone with a low dose CT? When do you start doing mammography? When do you start doing, prostate exam or PSA check kind of stuff? So you need to know all of those like the back of your hand going in. So with family med, the thing that makes studying for that hard is there's a lot of didactics. There's quizzes that are out there, and some of them are very difficult on Blackboard with decent time constraints. So just kind of, go into them prepared, do the case files, read through stuff. Don't go in thinking you're just going to kill it or whatever, because they were tough. But the load lightens as you get towards your test. But you have 2 months to study for something. A lot of people will be complacent and not do anything for the first month, and those are the people who end up not doing great. So use that first month to try to get as ahead as you can and see as much as you can. That way, in the last 2 weeks, you have the time to go back and look at OB or PEDS or something to make sure you know it. For that one, I basically didn't do practice questions until the second month of the rotation, just because there's so many cards for me to do, so much info to kind of get through. Plus, UWorld does not have a family med section. Their internal med section is very big, and that kind of encompasses stuff. But you can't sift for the family stuff. So again, ComQuest is the good one there. But I started that at about a month, or with 3 weeks left to go. Did all of the ComBank as well. And just kind of went into that COMAT as prepped as I could. And it's kind of the same thing. I didn't know that I was really even all that prepped for it. I felt like I was going to get popped by it. And that was my best score. That was a 133. The test didn't feel so bad because I had done so much prep. But biggest thing with family med is don't be complacent. Work hard in the clinic. Try to actually learn this stuff on a clinical level because then it sticks better. And again, do the didactics as quick as you reasonably can, as long as you're retaining the material somewhat. We don't expect you to know it first pass, but if you're taking I don't think you need the entire 4 weeks to do your didactics for it. Internal med, I was done with the didactics for both months in 3 weeks. Now we had COVID, so I had an excuse to be able to, kind of fly through it. But that's my advice for family med. It's hard if it's one of your early rotations because you don't have the background of peds or OB, which I didn't have OB yet, but it's manageable. It felt the most fair to me when I took the test. There weren't as many out of left field, what in the world is this things. But I know a lot of people that struggle with it. So my next rotation was psych. With psych, I went and actually had my PE, so missed some time there. But overall, psych really is more or less a pharmacology exam. That's the biggest thing that they hit you on, even though some people have told me that they barely had pharm on their test. But you need to know the disorders like the back of your hand. For major depressive, make sure you can count out the SIGI caps things. I had a lot of stuff differentiating, that from other disorders. So you just need to know the ins and outs of all the diseases. Know your pharm really well. Things like, what antipsychotic can you use in a pregnant woman, stuff like that. But they're going to go after that heavy. Each psych rotation is different. I worked, decent hours. They weren't so bad, so I had a lot of study time. But same thing, I did UWorld as quick as I could. And I'll tell you what, at the beginning of UWorld, I was getting slaughtered. Just because I hadn't seen this farm in so long. And then by the end, I was, scoring in the 90s before the question bank was over, just because I had time to finally catch up. Again, used Zonky deck and then ComQuest to round it out. And psych was the same thing. The test was decently difficult, but what I expected, and scored in that same range, a 123. OB, from the clinical side, it's going to be different for everyone. I know people who didn't catch a baby the entire time. I know someone who caught 22 on their rotation. I got cut short by COVID, but I still did 5 deliveries, plus whatever we did in the OR. Same thing here. Nothing changes with OB. It's a lot of UWorld, ComQuest, and the flashcards. Make sure you can differentiate all of the different, reasons for bleeding in a pregnant woman, all the different screening recommendations for them. When do you give Tdap? When do you give a flu shot? When do you do the diabetes screenings? That all comes in. Preeclampsia versus eclampsia. What do you do? It's really not that terrible of a subject to get through. There's a fair amount of info, but it's not quite as much as like family med. The difficulty is in the way they present it to you. You have to know a lot of intricacies of one versus another, or use best clinical judgment to figure that out. Same thing on that one, 123. So, and I went into it really not feeling good. Like I felt like I was going to not do well, but it ended up well. After that, I was out of the hospital because of COVID, and so my 2 internal med months didn't actually happen. Internal med is the tricky subject for a lot of people when it comes to studying. So The flashcard deck for it is the biggest one that there is. There's a lot of information. So if that's the way you're going to go, make sure you allot the time to get through it because it's very good. It is going to give you most everything you need. Once I got through that deck, I was doing very well on practice questions overall. Internal med is a massive amount of info. For me, having it last was a blessing and a curse. It was a curse because it had been so long since I had even seen some of these things from like step one. So I had a lot to review. But it was a blessing because it was right before my dedicated for step two. So it was a kind of a good transition in with, this massive, probably the biggest portion of step or COMLEX is internal medicine material. So that was nice there. Same thing. I did all of the didactics for both months of internal med, I think in like 2 or 3 weeks. I basically just devoted, 1 to 2 blocks a day of UWorld. And finished UWorld in like 4.5 or 5 weeks or something because I want to say it's like almost 1,500 questions for internal med at this point. So the biggest, by far the biggest block. So the thing I'll tell you is that if you have internal med and you are actually in the hospital, then yeah, you're probably not going to be able to do 2 blocks in a day. You might do 1 if your hours allot it. So if you don't finish the entire deck for internal, don't stress it that hard. I'm lucky that I was able to do a full pass and then about 70%, or I reset my question bank and then started random completely over. So don't stress it. Just do your best to get through it. I also did the ComQuest just to see as much as I possibly could before my COMAT. Same thing with the Zonky. I think I did some Emma Holiday, but not a whole lot. I felt pretty good going into that one. And that one I was at a 118. Didn't feel good test day. So wasn't shocked that my score dropped a little bit. But that's all of the rotations. I went from there into dedicated. And because of COVID, my dedicated was far too long. I took step 2 with essentially 6 weeks of study time, which, guys, is way too much. I'll tell you right now, the sweet spot is probably for most people, would be between 3 to 4 weeks at the most. A lot of this stuff is cramming like treatment plans into your head. So once I got out, to that 5 and 6 weeks with my test, I was really getting nervous, thinking like, man, I know I'm losing a lot of material. I just got to keep myself okay. And obviously it ended up well. I was very happy with my score, especially after walking out, and I'll talk about step in a minute. But then even, I took COMLEX 2 weeks later, and I don't have that score back, but just don't push yourself out like you did for step 1. It's not the same kind of material. 3 weeks of 3.5 weeks of study with taking the test at the end of the 4th is absolutely reasonable. For almost every person. I don't think your score really is going to climb too much beyond that. So that's that for 3rd year. Some things with the hospital is keep in mind that you're just a student. I hear things of students where, the things that they say, things that they do, the way they treat people, you need to understand that, when it comes to like a setting like the OR, there's literally not a person in that room that's less important than you. You are the most disposable piece. And in the hospital, that's the exact same. I know it's crazy to think that way, but it's true. You are one person there that, yes, we need to be there, we need to learn, but every other person there has a job that is more important than what you're doing. So be humble, because I promise you, like, this will humble you if you're not. But also just have a good attitude. Come in ready to learn. There's going to be days where, on my family med rotation, the first couple of days, I literally came home, I was like, I can't do this. Like, I don't know anything. And then by the 3rd week, I was proficient with most everything that was coming into the clinic. It just takes time. On surgery, I want to do surgery. And the preceptor I had would pimp us out on stuff. And I was not performing the way I wanted to and was in a panic. And you just get better and you adapt. So be prepared to be uncomfortable. Be prepared to feel stupid. There's nothing you can do to not look dumb at some point. You're going to. Just keep a good attitude. Treat everyone with respect. I don't care if it's the person, sweeping the floors or waxing the floors. That, again, you're still less important than that person when it comes to actual hospital function. And it will help you a lot, and people will respect a lot if that's your attitude towards things, that there's no one beneath you. So, keep working hard. Talking about STEP and COMLEX really quick, so that way you guys can come back to this later. STEP was significantly harder than COMLEX Level 2. People always, you will always hear from your preceptors or some other students ahead of you, like, oh, Step 2, that was the easiest test I ever took. It's the easiest test in med school. I don't know what Step 2 they took. That shit was ridiculous. It was so hard. And not hard from the sense of like, I have no idea what's going on right now. But from the sense of, they would give me a question, I would know the diagnosis, I'd have a very good idea of what I want to do, I'd look at the answer choices, and the answer choice that would immediately come to my head was not there. So it was always going to this secondary or tertiary kind of, well, what next? Or then I'm between two answers where I'm like, man, both of these are pretty good. How do I make a decision? And that's the thing, is you just have to decide. What am I doing? Am I putting a chest tube in this person, or am I sending them to the OR right now? And that's kind of all of what it comes down to. That test, it was a lot of, on Step 1, I felt absolutely confident in at least 70% of the test. On Step 2, I would say about 30% of my test felt like that. The rest of it was not pure guesses, but educated guesses, and then being 50-50 or so on stuff. So I walked out of the testing center, and I remember texting people and being like, I don't know. I think I just blew it. I think my shots are gone. And the next day I woke up and my preceptor asked me how it went. And I told him that you could tell me that I scored a 270, or you could tell me I failed, and I would believe you on either of them. So if you walk out of Step 2 and you feel like you just got obliterated, you did, but it will probably end up better than you expect. UWorld 1 and 2, again, the self-assessments are the best predictors. All of my NBMEs, except one of them, were pretty accurate, and that doesn't seem to be the case for most people. NBMEs are very much undershooters for most everyone, so don't stress them. The correlations for them are absurd. I know someone who failed one of them, and the correlation for that was in the 240s. Yeah, just how that test, one of those tests are. So UWorld 1 and 2 are your best predictors. If you need extra questions, do the NBMEs. UWorld 1 missed my score by 1 point. UWorld 2 was below it by 7. So keep that in mind moving forward. And again, your COMAT average score usually is the better predictor of how you're going to do, with internal med usually being the best correlation because that's the bulk of the test. So COMLEX was much, much, much easier. As far as the test goes, I didn't feel like I was racking my brain the whole time. Biostats, ethics from hell, things that realistically you can't prep for, kind of just deciding in the moment what you would do. And then OMM. It felt like a quarter of my test at least was those 3 subjects, if not more of it. So I walked out of there feeling okay. There's always the questions of, the COMLEX questions of what in the world is that? Like, why are you asking this? I don't even know what's going on, but it wasn't so bad. Again, still don't have my score. I just took it a week ago. But that's really it for everything. I don't think there's anything else. First aid for Step 2 is not that great of a textbook, so I don't necessarily recommend buying it. I bought it because I was dumb and ignored someone giving me that exact advice, and I would flip through it and be like, yeah, it's not organized well. It's not comprehensive at all. So UWorld is your best resource. Try to do at minimum a full pass of UWorld during the year. Then try to hit your missed questions if you're doing a 2-week dedicated. That way you hit the stuff again that you missed. I tried to do a full second pass and didn't feel like I was getting anything out of it because my scores were very high. I felt like I was recognizing questions, or the questions I was missing would be like 90% correct, but it was because I would read like 2 or 3 sentences in it and then skip to the bottom because I thought I remembered what the question was and I would miss it. But outside of that, I mean, just keep doing what you're doing. Work hard in the clinic and just take it day by day. Like you're gonna feel uncomfortable, you're gonna feel dumb, and that's where you need to be at. If you're perfectly comfortable with everything you're doing this entire year, you're not making yourself the best doctor you're going to be. If you're not scared to mess up, you're not putting yourself in situations to grow. And if your preceptors aren't challenging you enough to where you're getting things wrong, ask them to. I know a lot of people don't like to get pimped because they don't like to feel dumb or get things wrong. When you get things wrong, like you saw with UWorld, that's when you learn. No, it doesn't feel good when they do it, but you don't know what you don't know until it's pointed out to you. So I will post the flashcards for you guys that I have, probably type up a couple things of, the resources I use, but overall just get after it. You're done with probably the hardest part of medical school, the most grueling portion. This year, enjoy it, but there is still a lot of work to be done, lots of stuff to learn. If you have any questions, just shoot me an email or something, and I'll answer you guys as best I can. I have auditions starting next week, so that's why I decided to do this video now. But see y'all.